Hi there, it's Dr. Daniel Hockenberry with Ried Physical Therapy. So today we're going to be talking a little bit about some sports-related injuries. More importantly, today we're going to be talking about the feet, actually. So one we tend to see in the feet quite commonly is plantar fasciitis. Not always is this a sport-related injury, but in individuals who either haven't been running and they started running quite a bit, or individuals who have spent a lot of time on their feet that their body is not used to, we actually tend to see something called plantar fasciitis. Most of the time, this is kind of indicative of somebody who wakes up in the morning and the pain is much worse in their feet. They're usually limping around earlier in the morning, or they went for a long run. Their feet tended to start to hurt throughout it, maybe towards the end of that time, but especially when they wake up in the morning, that's usually a pretty good sign that is potentially what's going on. So what the first thing we do is, again, when I was talking about the knee, we rule out the other things around the ankle that could potentially be of injury. But if we're finding some tenderness right there at the base of the foot, actually right where the calcaneus, so the bone on the heel, usually there's a lot of tenderness right in that spot. And then as well as that, the morning pains and pains whenever they're up and walking around for long periods of time, that's usually when we go ahead, and that would be kind of the direction where we would diagnose the patient. But talking about how it can relate to sports is that if you go from a level of more inactivity to a level of high activity where you're putting a lot of strain through your feet, a couple things that can be a factor is if we don't have the right footwear, maybe we didn't prepare our body enough prior to getting to that level of activity, we can actually tend to see that plantar fascia, so the ligament that lies on the bottom there, will actually start to tighten up. Sometimes it can be due to some tightness in the back of the legs as well, but most often can be due to the tightness at the bottom of the foot there, which is actually the area that we'll start to treat in order to reduce the inflammation that's in there. So if it's early on, that plantar fasciitis hasn't been around for a long time, that may be more due to the activity that the patient was completing. If it's been along there for a while, they've been doing it for quite a long time, that might be more of a chronic inflammation. We wouldn't maybe relate that to a sport injury, but we would treat it the same nevertheless, and actually to be able to get them back into that activity more comfortably, dependent on if they're a sports-related patient or if they're someone who's just had it for a long period of time. Very similar progression going through there.